What up, YouTube? This is Ron again, and I was just wanted to talk to you about like nursing and having non-English patients because some people consider that a barrier, but you can consider that like an opportunity for growth. When a patient doesn't speak English, yes, it can be tiring and a hassle, but it can also be an experience to grow. The United States do not just have the same race, ethnicity, or whatever you want to call it. They don't have the same type of people in the US. We get people from everywhere. We have Middle Eastern, we have Asian, Black, African American, whatever terms you want to use, Hispanic. Or, Hispanic has like a whole umbrella of people from different countries that fall under. And they can all have different cultural practices too, or it can be specific to the family. But consider it an opportunity to grow as a nurse. Use that opportunity to like understand more about someone else's culture, and then you can use that to apply to a different patient scenario. So you can use those experiences and build upon that. You're not going to have the same patient every time, but that one time that you have a patient that was like someone else, you can use those experiences to help you out later. Um, I don't know. I remember hearing one time like a nurse say that they don't speak. I mean, I don't understand why are they in our country if they can't speak English, which I had to stay quiet because I can't really get into that there. But I feel like that's kind of wrong because people come here to escape prejudices in their country or religious different religious views or even just having a better life for their families. Having the children speak English and be bilingual, that's a huge advantage in our country right now. And just provide a better life for their family and for themselves. So if you understand that, I feel like that will help you become a better nurse and better understanding. Like I said before, nursing programs need to implement like different like common or have courses on providing transcultural care to their patients. Like understanding the culture or the basics of someone like different types of cultures and implementing that in their practice because when you have a patient, let's say from I don't know, Syria, you don't know how like what practices is different or whatever. You need to like be able to understand that. And then providing the proper resources for nurses on the units to help, gain a sense of solidarity, I guess. I hope that's the right word. But, have people on the same page. Like you're not gonna have all white clients all the time. It's gonna be someone that's from a different country and that's gonna need care and you're gonna be the first person to be or you're going to be the main person to be in contact with them, and you need to advocate for their health care, advocate for them. So yeah, I mean that's how I feel about the subject. Like me, when I have non-English patients, I love it. Like oh my god, I love like listening to people's different languages and like just seeing how I can figure out what their care needs are. Especially like I'm really good at reading like body language, and then I'm like clarifying with the family. I'm like, all right, I'm doing good. But like, yeah, it's a whole new ball game than what it was like probably 40 years ago. We have people from everywhere coming to our country, and you need to understand those differences, and then probably take a step back and understand your own prejudices and like the knowledge of other people's cultures that you don't have, so you don't end up accidentally offending someone or saying the wrong thing. You can't take stuff personal when you're a nurse, even though it's really, really hard. I have a few patients that kind of get under my skin, and I'm not going to even lie. It was sometimes that it was just like, I literally can't right now. And or like, I know, like, not prejudice, but one issue I have is like, when you see a patient that is fully able to do something for themselves and they choose not to, that's like a really hard pet peeve for me not to like, that doesn't get to me. And I mean, not I'm not perfect. Not every nurse is perfect, but that's something that is just really hard for me to like deal with as a nurse because I'm like, and you just try to like, no, you can do this, and that's just a huge pet peeve of mine when it comes to patients. I'm like, if you have me do all this stuff and I'm like, I'm gonna sit back and let you do it. Like, no, you're gonna have to try. That's something I have to. It's rough. Or like, circumstances lead to people, using drugs and stuff like that. And then you're like, they trying to use the nurse or the new nurse coming on to like get more drugs. And we were just like, no. So those situations like that is hard too. Like, and I know people can't help it. That is an illness within itself, but that is so rough. It was just like, no. I'm like, I don't feel comfortable trying to give you this stuff, and you are using us, and like that sense of being used is just not sitting well with me. So it's like that's when like communication with all the healthcare team members is important, passing on that information, and even going to people, other nurses is just like, okay, I'm struggling emotionally with this. Like how, like, can you just talk to me and help me out? But, or like even a charge nurse or your nursing supervisors. Like, some people have have been nurses for years, even though depending on what area they are in, they might not understand where you're coming from. So, and then they've been practicing for so long, so it's kind of rough. But yeah, getting back to the subject, you have to be understanding of people's cultures in this new day and age, and like understand that you don't want to have to advocate for them when they can't advocate for themselves, or people are not understanding what they're trying to say. And let's say you've been with them for like a week now, and like you're starting to like understand like how they communicate or know what facial expressions like stands for what. But yeah, I don't know. Like I said, I consider it an opportunity to grow as a nurse. Like I just love culture. I've been to 4 different countries in college, and I want to go to more places right now. And I absolutely love learning about different cultures. I love how if I come across someone of that background again, like, okay, I can use this and like how to communicate with them better. Um, yeah, that's all I wanted to say. But yeah, I feel like, especially in nursing programs or even like in the healthcare setting, they can do better with when it comes to like, maybe taking a course about, delivering appropriate cultural care to patients. Now, that would be a good idea. And I would love to learn about that. Like, all right, so here, even though different countries have different, cultural practices, but if someone did the research and found like commonalities on how to deliver that care, that would be important for us to know. For nurses, doctors, social work, yeah. But that's all I wanted to say. I hope this didn't come off too strong, and I hope it was like organized enough for y'all. But that's how I feel about when you have non-English speaking patients, like they need help just like any other person, and it might be a little bit of a barrier, but like you can learn from those experiences, and that just builds up your own background when it comes to nursing on how you can deliver care to nurses, and someone can rely on you when they have a patient that is from whatever country that they are from. And okay, so here is some commonalities, and like this is what I did. Be careful doing this, or like if they're not comfortable with a male patient, a male nurse, or a female nurse, okay, well maybe find someone else to do that part of the care, and then you can do everything else. So yeah, I hope y'all have a great day. Um, we're having like a nice little snowstorm right now, and I don't like it. It was like nice up until this point. So I'm about to go into hibernation again. Work-life balance when it's cold outside and snowing. Struggle bus. But yeah, it's struggle bus for me for real. But yeah, I hope nursing school is going well for you. I hope if you're a new nurse like me, everything is going well, and like comment below on how everything is going for you guys. Like I really want to know. Let me know if there's anything else I can help you guys with, guys, gals. the YouTube fam, nursing fam out with, and yeah. Plus, I got like new chairs for my apartment, so I can have somewhere to sit for like breakfast and dinner now. I love these chairs. It took me like an hour each to like make, well, basically an hour each to make these. It was like one of the most difficult chairs that I bought to make, and I was just like, dang it! But I love these chairs. It's really nice. Um, yeah, but comment below what y'all think of this video, and you know, any experience, any new experience in a healthcare setting can help you grow as a nurse. And like, you need to reach out for those opportunities and just, ask questions when you have those patients, and especially if they can like nod their head, or, it just helps you grow. Or if you can figure out, how to best communicate with them when you don't have anyone around. But yeah. All right, I'm done talking. Sorry, this video is getting a little bit long now, so bye. God bless. Good luck in nursing school. Good luck in your first nursing position. And let me know. Bye, YouTube nurses.